Recording. Okay, moving into Vesta, and then myself. Okay.
You ready?
Yes, the red is on.
Mommy, your iPod.
Have you ever witnessed a choking victim and not knowing what to do? Or maybe you would like to know what to do just in case you're in that circumstance. If so, you're in luck, because today you will learn the Heimlich maneuver. The Heimlich maneuver is a simple life-saving technique that you can accomplish in a simple step. Here are the things that you need to do. You need to identify that the victim is actually choking. You need to perform the Heimlich maneuver, and if the victim goes unconscious, you'll have to move on to CPR. This demonstration follows the American Heart Association guidelines on how to perform first aid for a choking adult. First, you need to ensure that your victim is actually choking. As with all assistance with first aid, the first thing you need to do is ensure that your scene is safe. You do not want to become a victim yourself. If the victim has a partial obstruction, encourage them to cough up the obstruction on their own. A partial obstruction would be seen with the patient able to breathe or cough effectively. If they can cough or talk, encourage them to cough it up on their own. Never pat them on the back, as gravity will force the object to go down their throat, not out. To ensure that the victim is choking, there are a few signs to look for. The first is the universal sign for choking. Go ahead and show. Or they will not be able to talk or cough. They cannot breathe effectively, and there may be changes in their skin color around their lips or their fingernails, or the victim can go unconscious. Those last couple of signs would be towards the very end of the choking. Okay, after you ensure the victim is choking, if there's a second person there, you'll have them call 911, or in the hospital, activate the EMS system. If you're by yourself, you will go straight into the Heimlich maneuver. First thing you're going to do is come up to your patient and let them know you are going to help. I'm going to help you. Then you're going to stand behind the victim. You're going to take one fist, thumb side, against their abdomen, above their navel but below their breastbone. You're going to take your other hand and put it above the fist. You're going to then do inward and upward thrusts. I'm not going to do as hard as you could because she's not actually choking. But inward and upward until the object is expelled. Once the object becomes expelled, you want to make sure that breathing returns to normal. If the object does not expel, you will continue to do this until the patient becomes unconscious. Go ahead and become unconscious. Once the victim becomes unconscious, you will lay them down on the ground. If you are by yourself, at this point, you will want to make sure you can call 911 if you have not called 911 yet. At this point, you will start CPR. To begin CPR, you will kneel next to the victim. You will place one hand on the middle of their sternum, just below the nipple line. You're going to put the palm right there and the other hand above it. You're going to interlock your fingers, and you're going to press down about 2 inches on the breastbone. I will not do this because she's actually conscious. You're going to do 30 quick compressions at least a rate of 100 per a minute. After you do 30 compressions, you'll come around to their head. You'll do what's called a head tilt chin lift. Hand on the forehead, fingers on the chin, and lift them up. Then you'll open their mouth. You'll see if you can see the object in their mouth. If you can see the object, you will go in and abstract the object. If you cannot, do not do a blind finger sweep and do not give them breaths. Otherwise, you will put the object further into their mouth. If you can't see the object, you'll continue on to the compressions. And you will keep doing 30 compressions and checking until the object is expelled or help arrives. So, now you know how to perform first aid on a choking victim. You first make sure the victim is choking. Then you will perform the Heimlich maneuver after the patient until it gets expelled. If the patient goes unconscious, then you will perform CPR until help arrives. And the next time you see a choking victim, you will know how to save a life. Thank you for your attention.